Good morning, everyone. I see that now the room is getting quickly populated. I would like to introduce myself while everybody is arriving. My name is Anna Castelli. I am working for EUROPARC Federation since the beginning of this year. Since the summer of this year, and I am a project officer based in Regensburg, and I am supporting the HPHPe Commission that today is present here. I really want to take the opportunity to thank you for being here, because actually, yes, I mean, we are getting close to the winter season's break, and we take this very high interest as a sign of the relevance of this topic. So as you have seen from the invitation, today our topic will be ways to well-being in nature, activating parks and protected areas as natural health centers. And basically, the focus of our case studies will be mental health. As next, I am working on some housekeeping. As introduction notes, please be reminded that we are recording. It is very important for us, if it's possible for you, to have your camera on, because it's nice to see your faces and not just talk to some dark screens. Please, as it was anticipated in the chat, we would like to see your name and the organization written, and also in case you have some health promotion project or health projects in pipeline, just flag that in the chat. We are going to use the chat also for questions, especially because we have such a big number of participants, and it makes it much more practical and manageable from our side. So just to anticipate, we are going to take the questions of the case studies just after the case studies, and at the end of the webinar, we are going to pick up the rest of the questions. So as soon as you have a question, just drop it in the chat, and we are going to answer them as soon as possible. So the recordings of all the webinars of EUROPARC Federation are stored in the website, and Esther is sharing now the link of where recordings are stored. You will get a notification as well. And last but not least, we would like you to fill in an evaluation form on the chat at the end of the webinar, and because we are very interested in your feedback, and we are going to share it, the feedback form at the end, and it will take just less than 5 minutes of your time. So my last point is today's agenda. So Peter Rowcliffe, the HPHPe chair, is going to do the setting the scene and welcoming and introducing the webinar. And then follow the case studies of Peak District National Park Authorities with John Henney and the Berchtesgadener Gardener Land Biosphere Region, sorry for the pronunciation, from Mike Krebs-Fehrman. After that, as I said, there will be questions on the case studies, and later Bridget Finton from NatuScot and from our HPHPe Commission will speak about using our Healthy Park, Healthy People toolkit to realize health projects. Final remarks and conclusion, final question and answers from Peter Rowcliffe. And give it over to you, Pete. Thank you.
Thanks, Anna. Good morning, everyone. Really good to see colleagues old and new and within Europe and out of Europe today joining us. So I'm your chair for today. I work for Nature Scott in my day job, but today I'm wearing my Federation hats. And as Anna says, that's as chair of the Healthy Parks, Healthy People Europe Commission, but also as vice chair of the council itself. For those less familiar with our work, the Federation is Europe's leading network of parks and protected areas with around 400 members in 37 countries. If you or your organization are not yet a member, why not think about joining today? Having access to webinars such as this and all the other activities that we do. Just to say a little bit about the organisation of the Federation, we have a core team, a staff team, which Anna and Esther, who are involved today, are part of in several countries. And they're also what we'd call sort of regional structures covering single countries or countries too. So there are, I guess, our sections. Our work covers a wide range of topics as illustrated on this slide, everything from, I guess, core management of protected areas through to tourism and large carnivores. And as of course, it includes health, which we're going to focus on today. Next slide, please. EUROPARC has had a long interest or long engagement in health work since 2008, at least 2008. And last year we launched the Healthy Parks, Healthy People Europe programme, building on some of the national approaches in Europe, but also the wider international movement, which started in Australia, Welcome Joe, and also United States, Canada, and Korea, to name just a few of the countries who are doing this with their protected areas. As well as Anna and myself, the programs we developed through a commission drawn from member organisations from Belgium, Estonia, Finland, Spain, and of course Scotland. Our members have expertise, but also enthusiasm for the subject. So if you're a member of EUROPARC and interested, please get in touch with us as we're still looking to expand the membership of the Commission. The goal of a programme is a simple one. We want to see happier and healthier people connected to nature-rich parks and protected areas. It's no coincidence that we launched this programme at the peak of COVID-19, where this topic has never been more relevant. While we're unfortunately distracted again by other significant issues, the triple challenge we face over climate, nature, and health remains central. Next slide, please. To support our members, we've produced resources listed here. Bridget will be saying more about the toolkit later on. We also do webinars and workshops, of course, and are currently looking for European funding to develop more practical action. More news on this hopefully soon. All of this material is available on our website, but please do get in touch with Anna and myself if you want to know more. Next slide and drum roll, please. We've been really wanting to increase networking of members on this subject. The fact we've got 60 odd folk today suggests there's a real enthusiasm to share good practice and learn from each other. So this month we've launched a new LinkedIn group. I appreciate this platform may not be for everyone, but if you are interested in regular posts and discussion on the rollout of this programme across Europe, please join us. Next slide, please. So on to the subject of today. This is going to be the first of several seminars we're planning on specific health issues and the role that parks and protected areas can play in addressing them. In selecting mental health and well-being, we're starting with a topic that is relevant to all of us as individuals, but also gets to the heart of what Healthy Parks, Healthy People can do in practice for everyone. Health warning. I'm certainly not a health professional, so I'm not going to go into the differences between the technical definitions of mental health and well-being, but I thought some context on the scale of a problem would be helpful in setting the scene. Mental health and well-being is not a new concern, but it's one that's certainly grown in importance as a health issue across Europe in recent years, partly as a result of COVID-19, but also because of the way we live, our modern lifestyles, and the range of social and economic influences on us. Our modern lives are increasing the toll on our well-being, and the impact on our young people is particularly stark. And the statistic here about 1 in 6 of our young people will have mental health issues during their lives. On the plus side, though, we know that nature is good medicine for us. Next slide, please, Anna. As this slide, as a number of words on this slide probably illustrates, there's a wealth of evidence which shows how connecting people with nature can support better mental health and well-being. And I've summarized the key links here in a sort of top 10. Perhaps one of the interesting things to note is that while much of the early evidence was generated by environmentalists, this is now as likely to be produced by the health sector, as these reports from World Health Organization and the UK mental health charity show. One of the breakthrough moments for us in Scotland was a moment at the height of COVID-19 restrictions, when Scottish Government health colleagues began running a high-profile campaign which advised the population, who were then locked down for all but an hour a day, to spend that time to distress in nature. And of course, Nature Scott's own survey evidence supports this too, which shows high numbers of people reporting mental health and well-being benefits of enjoying nature on a regular basis. And in more detailed research we did concerning people who weren't participating in nature or had just begun, showed that actually mental health was one of the reasons that people kept active, even if it wasn't a main driver to begin with. So nature is important. And on the blue box in this slide, I've quoted the slightly controversial but really useful research that's been done in Australia, which calculated the dollar value of protected areas for mental health, estimated at $6 trillion, which I think takes an awfully long time to count if you're doing it individually. That's about 5.5 trillion euros. So a really significant sum we're talking about here. And that's just from the health benefit from monthly visits to parks and protected areas. So we have an amazing asset for mental health, which we manage. Encouraging people to visit your park and protected area is, of course, a core business for many of us. But where we can really add value in terms of health and well-being is by developing a more targeted approach, which is focused on individuals and groups who will benefit the most in terms of health outcomes. This could be because they don't currently visit, or because they have specific issues which could be addressed through dedicated programs which parks and protected areas can put on, or support or encourage others to do so. The key feature of such programs and projects are listed here and further detailed in the toolkit. We're also just suggesting that embedding what is called the 5 Ways Well framework in these programs and projects can really be useful, not least because it builds on existing activity in many parks and protected areas. Developed by the New Economics Foundation on the basis of the existing evidence I've talked about, the 5 Ways Well framework has been widely adopted by the health sector in the UK. It focuses on specific activity, the 5 footsteps or ways shown here, which can support better mental health and well-being. Let's hear a bit more about 5 ways from a medical doctor, Dr. Khan, who's moved on from the Wildlife Trust to recently become the president of the RSPB in the UK.
A natural approach to health has been shown to improve our mental and physical well-being. We all lead busy lives and it's hard to fit it in sometimes, but getting outdoors and being with nature can have a profound effect on all of us and make us happier and healthier. So how can the Wildlife Trusts help? Through 5 evidence-based ways that can improve our overall well-being. Go for a gentle walk in your local park or nature reserve. Wildlife Trust provides safe and social activities that you can do at your own pace. You'll get used to a routine of green exercise and you'll start to notice the things around you, the small wonders of nature, hearing a bird, seeing a flower poke through a wall, just being in the moment. All of this is great for your mental well-being. So now you've started connecting with your natural surroundings. Getting that peace and quiet is great, but being socially connected to other people is really important too. The impact of loneliness on our physical and mental well-being can be huge. Your local Wildlife Trust has a range of activities that you can try, from regular volunteering to going on an organised walk around a nature reserve. Keeping the brain active has all sorts of benefits. There's always new things to learn about nature. There's really no limit to the benefits of learning new things and the joy it brings into our lives. Getting all this benefit from nature is great, but you're also helping your local wildlife and wild spaces to recover and thrive. This feels good and gives us purpose.
Thanks, Anna. There's always that moment of concern whenever you play a video on a webinar. So thankfully that worked, and hopefully was a useful insight into 5 ways well. A good example of a use of 5 ways framework, which we've used previously, is the Wild Ways project from Scotland, which we've featured in previous workshops and has been documented in one of the HPHPe case studies on our website if you want to know more. But equally valid are existing projects or new projects which involve many of the 5 ways but are not formally designed using this framework. And I guess the 2 case studies we've lined up today are going to illustrate that diversity in approach, both using the framework but in very different ways. What is common to all these projects is their specific health aims and their co-design or delivery with the health sector. At its most formal, this involves formal prescriptions or signposting to these programs and projects from GPs and other health professionals. It also involves funding for the health sector, as well as from protected areas themselves. And while challenging, it also involves monitoring and evaluation of health outcomes too. Next slide, please, Anna. So finally, before we move into the case studies, let me briefly introduce the concept of nature connectedness, which has been developed by a team of psychologists led by Miles Richardson and David Sheffield at the University of Derby. As this slide illustrates, this rather confusingly also has 5 elements which overlap with the 5 ways well. The importance of these steps lies in the development of a meaningful relationship they generate with nature, which is not guaranteed by simply visiting the outdoors or learning about it from a book or TV program. It is this relationship which can give us meaning and also leads to the pro-nature behaviours that we want to see from HPHPe programs alongside health outcomes. So having hopefully set the scene and got you thinking about these issues, let's hear from the first of our 2 case studies. So welcome Johanna from the Peak District National Park.
Good morning. Thank you for inviting me to talk about my work. So I'm Johanna. I work for the Peak District National Park. I've had the pleasure of working for the National Park for over 20 years, actually, in various engagement roles. But in the last couple of years, since 2020, I've specifically taken a lead on our health and wellbeing work. And this is a new role, emphasising kind of importance of this area of work for us. So Anna, if you could start the slide, that would be fantastic. So I thought I'd share just some nice pictures of the Peak District National Park. So this is one of the reservoirs in the valley. Oh, that's just moved, never mind. That's fine. So I thought I'd tell you a little, oh, that's fine, Anna, you can go forwards again now. That's fine. So next slide. Brilliant. So I thought I'd first of all tell you just a little bit about the Peak District National Park. So it was the first UK national park set up in 1951. A bit of a pioneering national park. I wanted to share this photograph partly because it's a view very close to home, so I can walk to this within half an hour. But it shows the Kinder Plateau, and this was a place where in the 1930s there was a mass trespass by people who were living in the urban areas around the national park who couldn't access this land, but organised and trespassed to get on the land. And this was seen as a really pivotal moment in the creation of national parks. So it just emphasised how important these protected landscapes are and how important it is for people to be able to access nature within them. So if you just click next, thank you. So this is a map of the Peak District National Park. You can see the boundary in green, and the kind of grey areas around the edges are showing all the urban areas around the national park. So it's surrounded by conurbations. So it's Manchester on one side, Sheffield on the next, lots of cities in the north, other cities down in the south. So millions of people are within an hour's drive of the Peak District National Park. But for whatever reason, many of those people don't access the national park. And because of this, we want to try and redress those perceived or those real barriers that people have to accessing the national park. So we've been working towards a diverse audience plan since 2020. And it has the aim of creating a national park loved and supported by diverse audiences, increasing awareness and connection to the national park to a wider audience than we have at this present moment in time. It has 3 focus areas, so focusing on young people, minority communities, and also health and wellbeing. And health and wellbeing is the area that I've been working on, but I have other colleagues that are working on the other focus areas. 3 elements that we kind of been working on in the plan. So I'll let you just read the words on there and I'll explain what they are a little bit. So the prevent aspect of it is about building those connections and those partnerships, making people aware that national parks are there to support people's health and well-being, making those connections with health sector and other organisations that support people's well-being. The restore aspect of it is around more the direct delivery that we can do ourselves. Despite being quite a small team, we do like to do and get out and show the value of the engagement work that we can do. And the last aspect of it is trying to model best practice. In the first couple of years of the plan, we've been working mainly on prevent and restore with some elements of Excel. I thought I'd just explain a little bit of language that might not be familiar to everybody throughout Europe. So if I could have the next slide a minute, Anna. So social prescribing in the UK. So if someone goes to a healthcare professional with any problems, they're not always going to be prescribed medicine or drugs. There's the opportunity for healthcare professionals to refer people to a range of local and non-clinical ways to support their health and well-being. And it's a growing area of work within the healthcare sector. Most areas would have social prescribing link workers that can signpost individuals, work with individuals and signpost them to these opportunities. And green social prescribing obviously has an emphasis on those interventions that people are signposted to being nature-based to improve people's health and well-being. Fantastic. So next slide, please. So I wanted to just talk a little bit about the work that we've done to connect with communities before I go into details of the case study that I'm going to share. When we started the diverse audience plan, it was in the middle of the pandemic, a little bit hard to actually get people out to engage in the national park or to engage with people while they're out in the national park. So we spent quite a lot of time building partnership links with key organisations, both within the national park and also in urban communities on the edges. And this was actually, it felt disadvantageous at the time, but it was actually really useful to be able to spend that time to make those connections with those communities and those organisations. But since coming out of the pandemic, we've been able to start delivering quite a lot of projects. So in 2022, we've been able to work with lots of community groups in many different ways to use green social prescribing to support mental health and also physical health to some degree. And they've ranged from kind of practical conservation sessions, fortnightly sessions that we run at one of our classrooms and wildlife areas. We've been delivering a whole variety of supported health walks, including those for people that are living with dementia. We've been running specifically some wellbeing walks that have had a real emphasis, including the 5 ways to wellbeing, mindfulness and nature connection. And I've been working over the last half of the year on developing a nature prescription in partnership with the RSPB, something that was piloted in Scotland, and we're going to be hopefully, well, we're definitely rolling this out in the new year in England, in the Peak District. because we're quite a small team and we have quite a limited budget, like many of the other protected areas, we've always had to find sources of funding for much of the work that we've been doing. And if you could have the next slide, please, Anna. We've been very fortunate to be surrounded by some pilot test and learn sites. So in 2020, the government decided to fund a 2-year project, putting £5.77 million, so a reasonable amount, to set up 7 pilot test and learn sites within the UK to test ways in which connecting people with nature can support mental well-being. And those sites were chosen in areas where people were living with health inequalities and in areas of multiple deprivation. So we're surrounded by 3 of those sites, one in Greater Manchester, one in Sheffield area, one in a Nottingham area, and also within the Peak District in Derbyshire. But we've been working closely with a couple of the sites, and we were lucky to get funding to work with 2 community organisations in Sheffield. And I'm just going to talk about the project that we did with SOAR, which is a community regeneration charity, that's a bit of a mouthful, in Sheffield, to deliver a project called Peak Prescriptions. So SOAR works, I'm just going to read the blurb that I pulled off their website. So they provide services to improve a person's health, well-being and employability, working directly with clients via our social prescribing link workers, well-being coaches, welfare coaches, employment coaches, development and volunteering centres. So they're well embedded in their communities, something which we are not. So working in partnership with them as an organisation that are linked to their communities was really valuable for us for this project. And it's based within an area with high levels of social and economic deprivation, and fantastic. So next slide, please. So nothing massively novel about the work that we were doing, but working with a very different audience. So we delivered 12 supported visits to the national park starting in May. We're having some visits this week. The last one is on Friday. Hopefully it'll be slightly less icy by that point. And the way that people could access these visits was being signposted by wellbeing coaches that were based within SOAR. So people that know people really well in the communities that would benefit from these trips. And nothing very novel, but a very supported health walk out in the national park, which included elements of mindfulness and nature connection, and definitely covered all the 5 ways to well-being. We led the walks in different locations, building confidence in visiting the national park. And we also ensured that we gave people the experience of visiting one of our visitor centres to encourage them to think about visiting themselves. They were well staffed by both ourselves and by SOAR, many volunteers from our organisation and staff, and some volunteers from SOAR came out on all the visits as well. So next slide, please. So I'm just going to share a few nice pictures and cover how we covered the 5 ways to well-being. So always an element of some walk, not a big walk, an accessible walk on easy trails. Lots of opportunities to slow down and take notice. You can see here, enjoying the flowers, using magnifiers to look closely. Input from our staff and our volunteers around learning about nature in the national park to cover the learn element, and many opportunities for connecting with individuals that are working for the national park and with each other. So there was always time for a cup of tea, and lots of cake was eaten, lots of opportunity for conversation. And many of these people that came out to the national park had been very socially isolated for long periods of time during the pandemic. So it was very, very important that we had that social contact. And the give element, so much support for each other was fantastic and wonderful, and very lovely to see. It's been a real privilege to work on this project. So next slide, please. At a national level, lots and lots of data is being collected and evaluated by the pilot tests and the learn schemes. So when the project comes to an end early next year, there'll be lots of very useful data that's coming out around the importance of connecting people and supporting people's mental well-being by connecting them with nature. So it should be some really interesting data that comes out of that. For our project, if you just click next for me, we collected data on numbers, so lots of quantitative data. So there were 100 people visits out to the national park. Some of them were repeats. There's a lovely picture of a group that came out and visited us in Castleton. If you could just click next for me, Anna. We took lots of videos and photographs. We also collected feedback from a reflection activity that we did during many of the visits, and lots of individual stories that we're going to write up as case studies. That's fine. You can click the next, Anna. Thank you. And I just wanted to share some of those reflections. So we did a simple reflection activity to capture the impact to a degree of these visits, but also to allow participants to have a bit of self-reflection themselves. So one of the questions we asked, what were some of the best parts of the visits? So a lovely mixture of not only connecting with people and the place, and also that sense of welcome and hospitality was felt. So a great connection between different communities and different places, and of course a love of cake and tea was always reflected on. Next slide, please. I'd like people to think about the emotions that they might have had. A whole range of emotions brought out from these visits, ranging from relaxed to empowered. Next slide, please. And as we all know, we suffer from quite a negativity bias in our brains, the thing that helps to keep us alive. But we countered this by encouraging people to do some positive savouring of the moment and think about a memory and reflection of this again, that it's a lot about the place, but it's also a lot about the people that were out on the trips. Next slide, please. And a lot of learning happened during the visit. So learning about the place, learning about nature, learning about the landscape, but also learning about themselves. So opportunities for self-development. Next slide, please. So I just wanted to summarize a little bit how this has been a really effective partnership. So it's linking ourselves that have a fantastic asset in the landscape of the Peak District National Park. And we have that knowledge of that landscape, and we have the infrastructure, we have the volunteers that can support this work, but we cannot reach those communities as easily as we have done by working with an organisation that's really embedded within that community. So it's a fantastic partnership that we've been working on. So we've had kind of clear lines of communication and understanding of each other's responsibilities in the project. So we would always cover all the health and safety aspects. There was a lot of duty of care that was held by the staff from SOAR for the individuals, and the fact that a lot of safeguarding of those individuals that are held within an organisation that has got lots of different ways that are supporting their well-being. We're just an element of it, although an important element. High levels of support from both organisations to help people to overcome some of the barriers that might prevent them from visiting the national park. And as always, with many partnerships, lots of flexibility in responding to the needs of people. So we had an aspiration that people will come out on a set of 3 visits with an introductory visit, followed by a visit that had more of an emphasis on using mindfulness and nature connection, and then following up with a visit to a visitor centre and a walk in that area, so that people will go on a bit of a journey. People leave complicated lives, and it was very hard to get people to commit to doing 3 consecutive visits. So just being relaxed about that and recognizing that aspiration was never going to happen, and it's been a bit of a mix and match, and people have joined when they've had, and that has worked well. So what next? It's been a very busy year, bit of a time for reflection. We're going to have a meeting with Saul to discuss where we go next with the project, but it's been the beginning of really good links with a community organisation in Sheffield. So we'll be exploring ways to move forwards. It feels like a good working model to replicate with other organisations. So we're exploring links to work with other organisations in many of the other urban areas around the national park. As we are a limited staff and limited capacity to connect with all the communities around the national park, in order to do a little bit more, we're creating a new volunteer role to support this area of work. And as ever, we're always exploring opportunities to find funding to develop this area of work as well. So I think that was all I was going to say. Hopefully that was useful and interesting. Thank you.
Thanks, Jo. That was a fantastic and inspirational talk, and illustrated quite a lot of what we're trying to do with Healthy Parks, Healthy People Europe. Unfortunately, we've got a problem with our second case study speaker, Maker from Germany, whose internet has crashed. So we may be struggling to get her. So I'm going to have to improvise slightly as chair, and we'll take some questions now on Jo's presentation and run into Bridget's description of the toolkit. So I think I can see two questions on the chat, Jo. So hopefully these are fair questions for you. The first one was about, I guess, training. The first one was from Suzanne in the Black Forest. So this was about training of well-being coaches. But I guess there's a more general question there about how much training and capacity building did you have to do with staff in the park? So specific question about well-being coaches, but also a more general question about training and capacity building.
Sorry, you cut out a little bit there, Peter. Could you just repeat the question?
That's okay. So a specific question from Suzanne about the wellbeing coaches and the training they received. And I guess a more general question from me about training of your Peak District Authority staff more generally around health and wellbeing.
So the wellbeing coaches based within SOAR, I know, get all sorts of training to support people. I don't know the full details of that because I just don't. In terms of the training that we have, so we kind of run friendly training. We've ensured our staff are familiar with that kind of work. The people that are working with these community groups have been working for the National Park for a long time, doing lots of engagement work. So in some respects, kind of by osmosis over the years, that we have those skills and knowledge to be able to connect people to the national parks. I'm personally doing a mindfulness course, training to be a mindfulness teacher. So that's elements that I've been able to bring in to the work.
Thanks, Jo. So it hasn't been a barrier to the park taking this on. It's utilised their existing skills and.
Totally. Yeah.
Okay.
Yeah.
Thank you. A few questions down the chat, so we'll just do this chronologically. So the next question was from Janie, which was about I guess you've presented on the qualitative health benefits, and the question is about is anyone measuring the quantitative health benefits, which of course gets us into quite an interesting area about patient confidentiality and how we best generalize some of that to get quantitative outputs. But I guess it's a straight yes or no question. Are you doing any quantitative outcomes from this?
On this project itself, because we are not we're not the only support for those individuals that are coming out to the national park. The organisation SOAR itself are collecting data around progression, changes, improvements that have been made. So in some respects, that actually makes it easier for us because we don't have to worry about confidentiality. We're not collecting data that we're not necessarily that familiar with collecting. You know, our experiences with landscapes, their experiences with supporting people in a greater extent to support their health and well-being. So there is data that's being collected around how it's made an impact on people's well-being. And as I said, that's all being fed back into, there's an enormous spreadsheet that I've seen that's been created as part of the pilot test and learn scheme. It actually makes me go cross-eyed when I look at it, and I'm grateful that I'm not filling it in. But there will be some really useful data that I think that will come out at the end of the pilot test and learns from the 7 sites. And so much green social prescribing has been delivered through this. We're just a tiny dot of the project. And all of the sites have done it in a slightly different way. So many of them have given funding for organisations to deliver projects, which are then evaluated to feed into the evaluation. And some have done it in a slightly different way, where they've just been propping up organisations and connecting those organisations that are already doing green social prescribing to work together in a more coherent way. So I think there's going to be some really interesting information coming out. Sorry, did that answer the question?
I think it's sort of done, but if not, Janie can come back in the chat or come onto the screen. I guess it's the holy grail, isn't it? There's lots of really good health promoting work going on in parks and protected areas across Europe. But does it register with national and European level health colleagues? And it would be great if we could bring it all together and come up with a 6 trillion figure or equivalent for Europe, but the complexity of doing that is really challenging for some of the reasons Joe has said. Hopefully it's something we'll be able to explore in if we can get some European funding for some of the projects that we've been thinking about. I'm going to move on to the other sort of bit of a question. So question, Joe, about the size of your team, but also a related question about the use of volunteers. And I guess the management of those volunteers. So how far can you take the volunteering role in terms of building capacity?
So I think there's a number of my team on this call today. I can never remember the exact number of us. So within the engagement team, we have place-based rangers who are specifically located in an area of the national park. So they have responsibilities around kind of access and rights of way, but also an engagement element of their work as well. And then we have 4 rangers that are more specifically based in direct engagement work, 3 of which actually I think are more young people work. There's 2 of us that are taking a lead on elements of the diverse audience plan. So not a huge team, but we have a large team of volunteer rangers, around 300, I believe. They get a whole year's worth of training, which covers all sorts of elements, so that they're massively well trained, able to go out on the hills for a really long period of time and walk miles, but also starting to increasingly give them the skills to be able to connect people to those landscapes to support well-being. And the new role that we're creating, an aspiration to have that as a bit of an add-on to the year-long training as well. So including elements of the importance of connecting to nature. So having a module that covers nature connectedness and mindfulness, ensuring that we have coverage of how to be more inclusive, working with more diverse audience, elements around supporting people living with dementia. So we're just at the beginning of developing that, but our aspiration is to provide as much training as possible for those individuals.
Thanks, Joe. That again is pretty impressive use and commitment to volunteering, which I'm sure colleagues around the room will be very, very interested in, if not quite jealous of in cases as well. Okay, I can't see, another one. Yeah, Joe, do you want to come in and say hello and just talk about your question? Is it quite a question? Hopefully this will work. Hi, Joe. Sorry to put you on the spot like that. I just thought you were obviously starting something similar in your part of Australia. So do you want to say a few words about that?
Yeah. Hello, Joe. Thank you, Peter and Bridget and Anna and Esther. Joe Haney, thank you for your presentation. I'm constantly just in awe of the work that you all are doing in Europe, which is amazing. We're about to start, or we're partway along the journey in Victoria, in Australia, in creating something really similar. And my question was, are you willing to share your diverse audience plan, which is actually a term I hadn't quite heard before. I've just taken on a new team with very similar objectives, and I would love to not reinvent the wheel and really learn from the leadership that you're showing.
Yes, certainly, most definitely. We can link outside of this, and I'm happy to share that plan and experiences that we've done. I got very confused there for a moment because I've actually been working with another Joe Hopkins, similar name, on a similar project. So apologies that I felt like I knew you. Nice to meet you.
Me too.
Thanks, Joe. And Joe, I guess that's a good time to plug the LinkedIn group, because that's exactly what we want to use the LinkedIn group for. We can put the diversity audience plan onto that, so we can share it quite easily with everyone, I hope. So please join it. Okay, I can't see any more. Can't see any more questions in the chat. You're let off for now, Joe. You might well have some questions at the end if depending on what happens to the discussion. As I said, unfortunately, Mika has dropped out altogether. So this has never happened, I don't think, to me before while hosting a webinar. So apologies for that. We will put her slides onto the website, so you'll be able to access them, and I think we'll try and bring her back for another go at a webinar in future, because her research was quite interesting, because it was looking at, I guess, quantifying health benefits in a very specific study context. So that would be really good to hear firsthand as well. But we will put the slides on the website as soon as we can. Bridget, I think you've been forewarned. We'll come to you and talking about the toolkit now. Thank you.
That's fine. Thanks, Pete. And thanks, Esther. I think he's going to run my slideshow.
Yep, coming right up.
So I'm Bridget Finton, and I work for Nature Scott, based just a bit north of Perth, Scotland. And I'm part of Pete's team when he's wearing his People into Places team leader hat. So, by way of brief introduction, I think for me the kind of sub agenda for this webinar is posing the question: are we doing all we can to make sure that our sites realise their potential to deliver better health? And I think it's something that well, I'd like to think after this event, people will perhaps ask themselves that question a bit more frequently. So this slot is for me. I'm going to briefly introduce the Healthy Parks, Healthy People Europe toolkit and encourage you to use it to help focus on those whose health would benefit the most by spending time in on your sites and connecting with your organizations. Next slide, thanks. So the aim of the toolkit is to help readers turn the principles of healthy parks, healthy people into practice by giving practical advice. We hope it'll be useful to a range of staff, including planners, site managers, wardens, rangers, engagement staff, interpretive staff, etc. From this wee snatch of the contents, you'll see that this shows the structure of the toolkit, and each of the 4 main chapters has a kind of structure within. Each of the chapters provides a bit of scene setting information, provides a set of key messages relevant to that chapter topic, also provides 1 or 2 case studies from around Europe, and more pertinently explores what you can do in terms of implementing more action for health on the ground. Next slide, thanks. So this is not terribly easy to read, but that's fine. I don't really want you to. It's just to provide you with these 7 topic headings. So on page 29 of the toolkit, you'll find this checklist summary, which outlines the 7 aspects of practical advice on implementation that are covered across the 4 chapters of the toolkit. So the summary is quite a useful place to start, actually, because it poses a small number of questions, but those questions are to start to get us thinking about whether we can do more to ensure the health and well-being benefits of our sites are realised. For example, I'll just kind of snatch a couple. Looking at the 7 topics, strategic planning poses the question, are there links between the site's management objectives and the regional and local health and well-being policy framework? In terms of site management, just as an example, does your site have a range of access provision from easygoing paths for people with health issues or disabilities to more specific equipment to promote physical activity? In terms of outreach, just are we posing a question, does your site link with health practitioners in the area and also to target groups to ensure that activity programs and volunteering opportunities that you're running on your sites cater for their needs? So in the 4 chapters, the what you can do checklists go into more detail, looking at those 7 topics. And the aim is to help you to identify your own goals and actions needed to achieve those goals. So next slide, please. And we'll look briefly at just 2 or 3 of these practical implementation topics, and what the toolkit kind of tries to do by giving examples and getting you thinking about what's going on your own sites, whether you're involved in planning, policy, or actually site management. So for the subtopic, if you like, of site management, the what you can do checklists give examples, and here I'm thinking a goal might be to provide a range of accessible opportunities for green exercise that meet diverse needs, and actions that fulfill that goal could include carry out an accessibility audit of key paths and trails, or provide site information and infrastructure that caters for specific health needs. Just a couple of examples. Moving on, next slide, thank you. I picked another topic area which is particularly key to this webinar. So in terms of project development, thinking here, projects could be about promoting your site as a health improvement resource. So yeah, promotion campaign, information provision. Project could be about providing better infrastructure or developing nature-based activity programs, support into programs aimed specifically at target groups or health conditions. So a key principle here, Joe's already mentioned the vital need to work in partnership. So yeah, key principle in project development is encouraging you to work in partnership with local health practitioners, support groups perhaps, groups that are working and supporting people with particular health issues or needs, or organizations that run green exercise interventions. And yes, when you start looking, there are many of these community-based very well connected with their communities and able to link the people that they work with to green places, parks, protected areas. So yes, today, whilst we've focused on the principles of the 5 ways to well-being in nature, we're encouraging you to develop a whole range of nature-based activities and interventions which are sure to link to all or some of those ways, either directly or indirectly. Hence the 5 wee footsteps there. Next slide. Thanks, Esther. Just very briefly, two more of the practical topics that the toolkit covers. 2 more aspects of implementation that are really important to think about and identify your own goals and actions that will mean that you link with partners that can help reach target staff. So thinking primarily in the health sector here, communities and groups. Just kind of an aside here, having worked in Nature Scott on the health agenda for a number of years, I think that there is sometimes, particularly in the early days, a little bit of reticence perhaps for environment sector staff to reach out and connect with the health sector, partly because we feel we don't know the health sector's language, and possibly we feel that the health sector won't understand where we're coming from. However, it's a very satisfying process to go through to connect with colleagues working in health, working with people who we would very much like to see making more use of the outdoors and our sites. So yeah, and just thinking about communications, that it's extremely important that information about our sites, your sites, reaches health groups, target groups, who would really benefit from getting more connected with nature. I don't know whether Joe Honey was on this webinar yesterday, but I heard just yesterday on a DEFRA organised webinar about the test and learn sites that Joe was talking about. And part of what was presented at that webinar was about research that has recently been done that showed that health practitioners would refer more people to nature-based interventions if they had better information, easier accessed information about local places and opportunities that their patients, their service users would be able to get to. So yes, if they had a better source of accessible information about local places and opportunities, they would refer more people to participate and utilize those resources. Last slide, thanks, Esther. So I hope that that's given you a feel for what the toolkit has. It's a great resource. I would encourage you to look at the toolkit and to use it to help more people feel healthier and happier because they've spent time at your sites. Here is the URL, and I think that's been put in the chat as well. There we go. Thank you very much for listening. Thank you, and back to Pete.
Thanks, Bridget. I can't see any questions in the chat, although we have now put the toolkit in. I'm quite interested if there are any people out there who've looked at the toolkit and have been trying to use this in their work. Put any comments you want on the chat. I don't think Micah has turned up. Nope. So we're going to be missing a case study, I'm afraid. But as I said, we'll put the slides as part of the webinar tool deck that we put on the website in a moment or two. Anna, I think we'll probably go to the word
Sorry,
cloud.
Micah managed to link in.
To link in, okay.
Yes.
Fantastic. Welcome, Micah.
We managed.
We've rearranged the agenda, so you're the last act now, but welcome and really interested in hearing your case study.
Okay, thank you very much. I'm sorry for the technical problems. Okay, thank you very much for the opportunity to present our research project, Green Care, Nature and Mental Health. I have to apologize for my poor English skills. It's the first time that I speak about my project in English, and I hope that you can understand everything well. If not, don't be afraid to ask. I'll do my best. So let's start with the presentation. Okay, you already started it, so I don't need to share. Okay, thank you. In our research project, we are scientifically investigating how certain mindfulness exercises can be used in nature to reduce stress, and furthermore, whether these exercises have an improvement for patients with depression. In addition to the health aspects, we are also interested in whether these exercises increase the willingness to act in a way that protects nature conservation. And since I'm mainly the woman for practical work in nature, I would like to share some of my experiences with you. So first of all, I would like to give you a brief overview of my presentation. I will talk about framework conditions of the project, duration, finances, and partners, about the biosphere region Berchtesgadener Land. This is where I am right now. The nature-based mindfulness training, that's the training I developed for our project. And I'll talk about research questions, monitoring and scales, about my probands and groups. And I'd like to mention some challenges posed by the corona pandemic. And also I'd like to share further questions that have arisen from our research. As you know, you start with a few questions into a research and you end up with even more questions. Okay, the next, please. Yeah, so I got you a map of Germany on the right, and you see those green areas. Those are biosphere reserves. We have 16 in Germany, and you see 2 red squares. The one in the middle, that is our partner biosphere reserve Rhön, the Bavarian part. And in the southeast, you see another square, and this is where I am in the biosphere region, Berchtesgadener Land. So we started with the project in November 2018, and we will finish September next year. Our project is financed by the Bavarian State Ministry of Environment and Consumer Protection and the Bavarian State Ministry of Health and Care. And this is actually the first time that these 2 ministries have jointly financed a project, which is a bit surprising because environment and health just belong together. Okay, the next. Yes, I got you a photo of a typical landscape here in the biosphere region. We have mainly villages and smaller towns, so it's a rural area. The biggest city is Bad Reichenhall with about 19,000 inhabitants. Okay, the next, please. Yeah, we are the only German biosphere region with alpine and pre-alpine landscapes. And I got you a photo on the right. You see a little town with a chapel in the middle. This town belongs to our biosphere region, and then you see two bridges, a bridge on the right and a bridge on the left, and on the other side of the river it's already Austria. So we are very close to the Austrian border, and we feel very much connected to our Austrian neighbors. So we are near Salzburg. And yes, we have pre-alpine and alpine landscapes, and the highest mountain here is the Watzmann. You may know it's 2,713 meters high in the northern limestone Alps. Okay, the next, please. I'd like to talk about the nature-based mindfulness training now. The goal is supporting mindfulness, relaxation, and emotional attachment to nature. I developed this training, and it is based on exercises from MBSR, mindfulness-based stress reduction, combined with exercises from nature education, perceptual exercises with all senses, experiencing nature and anchoring to the present, building a forest sofa or small camp. I am not sure if forest sofa is the right English term, but I'll show you on photos later. I do body awareness exercises with my groups, like body scans, walking barefoot, walking meditation, mindful yoga. We are reading animal tracks, watching and getting in contact with animals and plants, and breathing meditation, loving kindness meditation, and psychological reflections of the exercises in the group. So it's all about discover nature as a resource for your own everyday life. Okay, the next, please. We have some research questions, and how can the nature-based mindfulness training be used in the psychosomatic rehabilitation with patients with depression, and how can the training be used for the prevention of stress disorders and burnout in the general population? Is the nature-based mindfulness training effective in the short term, and is it subjectively experienced as effective by the participants? Is the nature-based mindfulness training effective in the long term, and do the participants incorporate what they have learned into their everyday life? So we did a quantitative survey with questionnaires and additional 15 qualitative expert interviews. We have an independent scientific monitoring that was very important for us by the Catholic University of Eichstätt-Ingolstadt, the evaluation team of the Chair of Work and Organizational Psychology. Okay, the next, please. Okay, about the scales of questionnaires we used. We had a central criterion variable that is PANAS, positive and negative affect schedule, for the measurement of emotional state, and additional criterion variables, mindful attention and awareness scale, state self-compassion scale, measurement of depression, nature-based mindfulness, emotional connection with nature, and others. And we had 3 survey times. The first right before the intervention, then the second directly after the intervention, and the third 3 months after the intervention as an follow-up. So I worked with different probands and groups, with clinical groups in Rhön and Berchtesgadener Land, and preventive groups. So we work together with 2 departments of psychosomatic rehabilitation. We had patients with diagnosed depression, 96 persons in the experimental group and 96 persons in the control group. I met the group once a week for 4 hours. And we had small groups with about 4 to 8 probands, and I was the head trainer, and I was accompanied by a clinic therapist. So we went outside in any weather except for severe storm warnings. And the preventive groups, I had 48 persons in the experimental groups and 48 in the control groups. Those people were from the general population, healthy people without diagnosed mental illness. And also the groups were small, 4 to 12 probands, and I was the head trainer accompanied by a behavioral therapist. Okay, I'd like to show you the different locations of the clinical groups. This is quite interesting. In Berchtesgadener Land, you see the map on the left. I went into a city forest with the patients because this city forest is close to the department, and well, it is in Bad Reichenhall, so you hear traffic and everything. And on the right, you see a picture of the place, of the location in the Rhön. And as you see, it is a larger forest where you don't hear any traffic, and it's more like wilderness. I mean, we don't have real wilderness in Germany anymore, but it's a huge forest area. Okay, I'd like to show you some pictures from my training. On the right, you see us practicing a meditation. I call the what else meditation. The question what else refers to what is still perceptible at this moment besides the many thoughts that someone has. You probably know that one problem with depression is that the thoughts circle in constant spirals that pull down. And I try to train with the participants how these spirals can be broken for a short time by concentrating on what the present moment still holds. And there you see this forest sofa. It is just something you build in the forest to sit on. And we build a little camp, as you see on the left. And you also see us practice walking meditation in a meadow. So we practice different kinds of walking meditation to get focused. And I got you some more pictures. At the top left, you can see yoga exercises performed in contact with trees. We use the trees to keep the balance better, but also to be in contact with the trees. It's always about connection to nature and connection to oneself. And we are cooking the leaves of a stinging nettle for an eating meditation. I'm not sure if you have stinging nettles in Scotland or in the countries where you are. For me, the stinging nettle is a plant of mindfulness. We are also using binoculars, looking at the leaves of a stinging nettle is very impressive. Okay, the next we will have the final report of the university in March 2023. So 2 weeks ago, we got some first results, but we will have to wait until the final report. The first results, the clinical research, a significant positive influence of the interventions on the criterion variable effect, as well as as on the construct of self-compassion and the construct closeness to nature could be demonstrated. In addition, tendencies were found in the constructs of depression, mindfulness, nature-related mindfulness, nature protection readiness, and nature protection behaviors. And no differences were found whether a group was in the wilderness or in the city forest. And this is surprising at first glance. One would expect that a secluded place in nature offers better conditions for training, but that does not seem to be the case so far. If you practice mindfulness exercises, you know that disturbances can be helpful in deepening your exercise practice. In the course, I made the experience that, for example, sounds of cars in the distance can help very well to recognize one's own psychological mechanisms from stimulus response patterns. And you can practice very well to focus your attention on other aspects of the present, for example, rustling in the leaves or bird song, because the present moment consists of a whole range of sensory impressions. And it's not necessary to focus on one specific sound. I practice with the participants to perceive as much of the present moment as possible, as if in slow motion, and not to evaluate the content of the experience in a negative way, or to notice the evaluations, to explore them, and to let go with self-compassion and a loving look. But that is only my interpretation, and we'll have to wait until the final report. So concerning the preventive research, a significant positive influence of the interventions on the criterion variable effect, as well as on the construct of nature-related mindfulness, emotional closeness to nature, and internal attribution of responsibility for the protection of nature could be demonstrated. In addition, tendencies were found in the constructs of mindfulness, self-compassion, and nature protecting behaviors. The mentioned effects weakened slightly after 3 months, but were nevertheless stable compared to the first survey. So a long time effectiveness of the training could be statistically proven so far. Okay, the next one, please. Yeah, we had some problems, of course, or some challenges posed by the corona pandemic, and I want to mention some of them because of the lockdowns in Germany, delays and higher stress level. In the clinical area, we had temporarily reduced bed capacity in the clinic. We had high stress situation at the clinics due to illness, absences in the staff and measures, sickness absences in patients. So that led to reduced group size and dropout. And FFP2 masks make communication more difficult at information events. In the preventive area, I had to cancel 6 groups between spring 2020 and autumn 2021. And I recognized a very high stress situation of the participants, especially for parents with primary school pupil or preschooler. Okay, the next one. Yeah, now I come to further questions that have arisen from our research. I only wrote down 2. I have even many more, but I'd like to share these 2 questions with you. Differences between men and women. Further research is needed to understand more precisely what the differences in the experience of nature and the experiential content of mindfulness exercises between men and women are, and whether this has consequences for practical work, and to what extent do military experiences in the field influence the experience of nature. And a second question concerning growing up in nature: to what extent do childhood experiences in nature influence the chances of well-being in nature in adulthood? In the future, we will meet more and more adults who have not had any experience of nature in their childhood. What are the chances that these adults can experience nature as a boost for their mental health? Yes, so I thank you very much for your attention.
Thanks, Micah, and appreciate the hassle you might have had trying to get back on, and it was really worth it. Thank you. And your English is excellent, of course, so no need to apologise for that.
Thank you.
Lots of questions in the chat. We might not have time for all of them. Really interesting about the nature, what is the quality of nature, and what impact that has on health interventions. That's a deep issue which we could probably spend a whole webinar talking about, if not a whole set of research. But the three questions I'm just going to focus on. One was just about, could you say anything about the connection between this project and the biosphere reserve itself, the staff? What was their engagement in the project?
Well, I work for the biosphere region, so it is our project, and we are a region for sustainability, and so health always have to do with sustainability as well. And so actually we came from nature education, and in already 10 years ago or so, and we noticed that in nature education people also have a benefit for their mental health, and so we just wanted to know what it's all about, and that is that was the main idea to start this project.
Okay, thank you. And from what you're saying there, I guess the Biosphere Reserve has a strategic interest and approach around nature and health, which I guess was the background to this project, rather like
Yes.
the Peak District explained about it being a strategy.
Mm-hmm.
Yeah, okay. So a more specific question, and I guess the variant answer to this might be different to other answers to this, but where can we find providers on nature meditation and other similar techniques? So I guess that's a good question for most protected areas. We want to do this in our parks, but where can we find the people who are trained up in this? So how did you find the people to deliver these programs, Micah?
Well, right now it's only me and the therapist who came with me, but we are planning a training program so others will be able to lead groups. But by now, I don't know, there are not many trainers yet.
Okay. And
I mean, yeah. It's
sorry,
a bit
Mike.
hard for me to explain.
That's okay. We all have one of the interesting things about health is that we all do health very differently in our countries and our regions, and even with individual health sector practices or sites, it's all done quite differently. So you do have to experiment and work out what works best for your park or protected area, I think. I would probably emphasize the general lesson is that the people who know about this stuff are the health sector. So actually having the dialogue with them will open up doors in terms of knowledge and expertise and people who can deliver some of these programs. And I guess Joe's approach, what we've heard about in the Peak District, also shows, I guess, the importance of training and capacity building within the park itself. Okay, really lots of people interested in the methodology. I don't think we've got time to get into that, but we'll try and provide some more information on that in the material we put online for the webinar. I guess the other thing I would draw out from this is around the 5 years of funding that you've got.
Yes.
Which I guess allows the in-depth research that has been going on here, which I think is really excellent. And it's finding ways to replicate that in our own countries and regions, I think is critical to getting into the detailed research that we've got in here. I'm just going to look to Anna. Are there any other last questions that I need to pick up?
Not in addition to, no, not new ones. About the final report, if it's when it will be available and it will be publicly available.
Yeah.
Yeah, I don't know yet. There will be publications, but I don't know yet when. But I will give you the information. So
And everything,
the
everything
first
you have is in German.
yeah, but I think the university, they will write in English as well. So
Okay, and there are some fantastic online translation
yes.
services now too. So
Yes.
okay, that would be a really useful resource to dip into. Okay, I've got a final question, which I think it worth answering. You talked about the results showing pro-nature behaviours emerging. The question was about how you measured those.
That's a certain scale in the questionnaires.
Okay.
About I can give you the questionnaire, I think, or I can give you the scales, so you can have a look at it afterwards, what
Okay.
we measured and how we measured it.
Thank you very much. That would be excellent. Okay, I'm going to stop there. Time is against us as ever, and although nearly everyone has stayed to the end, which is a good sign, and I guess reflects the quality of the case studies that we've heard about and Bridget's presentation on the toolkit too. I guess in closing, I'm going to just say a few words. Some themes I think we tried to bring out in the webinar. I'm just going to refocus on those. So the importance of partnerships with health and other sectors has come out here. Academic sector as well in the last presentation. Focus on, I guess, for mental health and well-being conditions that are relevant to your populations. And also, we haven't talked about it directly, but health inequalities and trying to reduce those rather than raise those up. We've had an interesting insight into the difficulties, but also the benefits of monitoring and evaluation of health outcomes. A really tricky area, but something the Commission, I think, wants to look at more, because magic numbers, to quote an ex-commissioner, are really important here. And then the importance of communications, particularly how we build those partnerships, but also I think Bridget brought out a really interesting point about trust between health professionals and parks and protected area managers. We've also talked about training and capacity building of our staff, and really useful insight around volunteering and the role that volunteering can play from the Peak District. And hopefully we've managed to thread all this through with the 5 ways well, and I guess the use of that framework in thinking about what we might do in our parks and protected areas. It is a really useful framework, we think, and something we want to do and see more of across Europe if we can. Of course, tailored to your specific needs and circumstances. It's not a blueprint, it's a framework approach we're trying to develop here. So thank you for all that. We were going to do a word cloud, so Anna's going to put that into the chat, I hope. Or perhaps not, looking.
We are putting it into the feedback form so that we save some time.
Okay, we'll put it into the feedback form. And I guess the two final things to do is to thank all the speakers today. Really interesting content, and the technology just about worked for us all in the end. And then the second thing is just to say thank you for your attendance and your interest and your questions. We'd like one last ask from everyone here, as many people who can, is just to fill out the feedback form, and particularly word cloud, etc. So we really want to hear your feedback, and where we should go next with this work is really important that we get feedback, so we can build something that's relevant to members of EUROPARC Federation and others who are interested in this agenda. So thank you all. Final thanks to Anna and Esther for organising us really well, and have a great Christmas, and see you all in 2023, I hope. Bye for now.